In your last 4 years at Nestlé, you designed a risk management strategy based on optimizing the funding of insured benefits. And you really worked well with the procurement and HR teams to make that work. What did you find that had to change in the way that the HR team were thinking to make that work? And then what had to change for the procurement team?
Okay. Well, traditionally, finance and risk management and HR and procurement actually work in silos. And I think that's actually what is one of the main issues actually for not generating a collaborative spirit between the various functions. So I think what was the key for a risk manager to actually work together with HR is to make them aware that there are ways of actually influencing the cost of medical benefits and employee benefits together. To increase this awareness, I mean, you have to have access to data to actually show what is actually the amount at stake and how through a number of risk financing techniques you can actually influence positively the evolution of those costs. And in particular, I mean, this is what can actually drive the change is the fact that the company starts to decide that considering the amount at stake, it makes sense to centralize and streamline the processes which are applicable to these employee benefits.
So having gone through that process, what are the learnings that you got from that you would really like to share with other benefit managers out there who might be considering the same thing?
So coming back to the first question, I think that you have actually functions that use different terminology, but actually it's the different ways of talking at the same things, basically. So what you have, one of the main learnings is actually to create a common language where each function understands what is the added value of each other to create actually a collaborative project. And coming back to data, which I think is the key word, is that having access to this data is a way to actually measure where you are and how you can monitor progress going forward. And so I think one of the key lessons is actually that you can work together for the benefit of the company, but also for the employees, because the data will also help you to understand what are the key drivers between your medical costs, so then you can influence the health of the employees and the productivity of the employees for the benefit of the company.
So, but it's a common language is really what you're saying, and understanding each other, and that's common objective. And what would you say were the greatest successes of that particular project?
Well, I think the greatest success is really to make it more apparent for the management of the company that there were the costs represented by medical costs, for example. I mean, this was actually when I started being involved with this project. I mean, there was no proper inventory of the cost by country. We are talking of hundreds of millions of dollars, and that was pre-COVID. And I think that that made the management aware that actually there were an issue, and there was actually a way of influencing cost that were increasing faster than the sales and the profit of the company.